Giving medication to a child, it's not just about using smaller doses, is it? Nope. It's a completely different world. And honestly, the stakes are so much higher. Today, we're going to break down the science and really the art of pediatric medication administration. The goal? To make sure you can do it safely and feel confident every single time. Let's dive in.
You know, everything we're about to map out, every single concept, it all flows from this one core biological fact. This isn't just a random piece of trivia for your exam. It's the fundamental principle that drives every calculation, every technique, and every safety check in pediatric care.
And that leads us to the big question, right? If we know their little bodies are still developing, how do we change what we do to protect them? How do we make absolutely sure that every dose we give is not just going to work, but above all, that it's safe? Let's walk through the visual guide together.
So here's our game plan. We'll kick things off with the basic physiology, the why. Then we'll get practical with oral meds, injections, and IVs. After that, we're going to tackle those dosage calculations head on so you can feel totally confident. And finally, we'll bring it all together by talking about how to adapt our care for kids of all ages.
All right, first up, let's talk physiology. Nailing this down is the bedrock for safe practice. It's the why behind every how we're about to cover, and the very first step in building that mental map for great pediatric care.
Okay, so let's really picture what's happening inside the body. A medication goes in. Now in an adult, the liver's like a busy, efficient factory, breaking it down, and the kidneys are a powerful filtration system, clearing it out. But in an infant? Well, that liver factory is running with a skeleton crew, and the kidney's filtration system is still being built. This means drugs hang around in their system way longer and at higher concentrations, which just skyrockets the risk of toxicity. This concept is absolutely priority number one. Let's move on to the most common route, giving medications by mouth. Now, proper technique here isn't just a nice to have, it is a critical safety measure. And you'll see how just a few common mistakes can have really serious consequences.
So this slide really breaks down the why behind each physical step. See, positioning them upright, that uses gravity to help the liquid go down the right pipe, the esophagus, not the airway. Placing the syringe in that little cheek pouch on the side, that bypasses the main taste buds and helps avoid triggering a gag reflex. And going slow, well, that just gives them time to swallow. It's all about how these small, precise techniques directly prevent aspiration.
And how do we make sure the dose is right? We use the right tools. Look at these devices here. The magic word is calibrated. A spoon from the kitchen drawer is not a medical device. I'm serious. The difference between what someone thinks a teaspoon is and an actual 5 milliliters can be the difference between a therapeutic dose and a toxic one. Always, always use a proper measuring device.
Now for the big don'ts. It is so tempting to just hide some yucky medicine in a bottle of formula, right? But if that baby doesn't finish the whole bottle, they don't get the whole dose. Even worse, they might start to think their main source of food tastes bad. And crushing a timed-release tablet? Whoa, that's like setting off a bomb. You're releasing an entire day's worth of medication all at once. It's incredibly dangerous.
Okay, let's switch gears and talk about parenteral routes. When we're talking about injections and IVs, being precise with where you put them and how you manage fluids isn't just important, it is absolutely critical. For an infant, this is the spot you need to have burned into your memory. The vastus lateralis. It's that big, meaty muscle on the outer part of the thigh. So why here? Two huge reasons. One, it's a well-developed muscle, even on tiny babies. And two, it's located safely away from major nerves, like the sciatic nerve and big blood vessels. It is simply the safest target. And this chart here shows you not just where, but how much to inject. An infant's muscle just can't handle a lot of fluid. Look at that maximum volume for an infant's vastus lateralis. It's only 0.5 milliliter. Pushing more than that is painful, it can damage the tissue, and the medication won't even be absorbed properly. Okay, this is a huge safety alert for IVs. You know that 10 milliliter saline flash you might do for an adult without even thinking twice? Well, in a tiny 4-kilogram infant, that's a significant amount of fluid. Every single milliliter, the drug, the fluid it's mixed in, the flush, it all has to be tracked like a hawk to prevent fluid overload, which their little kidneys just can't handle. Okay, let's switch gears to the part that I know can cause a little bit of anxiety, dosage calculations. But don't worry, this is not about being a math genius. It's about following a simple, consistent process to guarantee your patient's safety. We're going to walk through it step by step. Every single calculation you do is going to start right here. Because a child's body changes so fast as they grow, their weight is the single best clue we have about their body's ability to handle medication. That's why almost all pediatric doses are based on weight. So converting pounds to kilograms by dividing by 2.2 isn't just some formula. It's your first step to safe dosing.
All right, let's put this into practice with a typical problem you might see on an exam. You've got the doctor's order, the child's weight, and the safe dose range from your drug guide. Your only job is to check the math. Let's solve it together. Okay, step 1, convert the weight. 15 pounds divided by 2.2 gets us 6.8 kilograms. Step 2, let's figure out this child's personal safe range. 6.8 kilograms times 50 milligrams gives a low end of 340, and 6.8 kilograms times 75 milligrams gives a high end of 510. Step 3, compare. Is the doctor's order of 500 milligrams inside our safe window of 340 to 510? Yup, it sure is.
So we can say with total confidence that this dose is safe to give. See? It's a logical, step-by-step process. No guessing involved, just verification. Let's try another one. This next scenario really highlights your job as the final safety check. We've got an order for ampicillin, 850 milligrams, for a child who weighs 36 pounds. The book says the safe dose is 50 milligrams per kilogram. Let's run the numbers. We follow the exact same steps. First, convert the weight. 36 pounds is 16.4 kilograms. Then, calculate the maximum safe dose for this specific kid. 16.4 kilograms times 50 milligrams equals 820 milligrams. And now for the most important step, compare. The order is for 850 milligrams. Our calculation says the max safe dose is 820 milligrams. The numbers don't add up. The dose is not safe. And this is the moment where everything stops. This simple calculation is your power to protect your patient. You do not give the medication. You pick up the phone, you question the order, and you get clarification. You are the last line of defense.
Okay, so we've got the technical skills down, but giving medicine isn't just about science. It's also about connecting with a person. And that means we have to change our approach based on their developmental stage. And the difference is huge, right? For a toddler, you're using simple words. You understand that fighting back is just a normal reaction to being scared, and you're ready with a hug right after. But for a teenager, it's all about respect. You explain everything thoroughly. You give them choices and control whenever you can. You treat them like a partner in their own healthcare, not just someone things are being done to.
So we've walked through the science of pediatric medication administration. But just remember, it's never just about the numbers and the techniques. It's about earning the trust of every child and every family you care for. And that right there is the art of nursing.